Thank you, Chairwoman Eshoo. This committee takes another important step in protecting our youth from a life of chronic disease, disability, and death from tobacco products and nicotine addiction. We'll consider H.R. 2339, the Reversing the Youth Tobacco Epidemic Act of 2019, which is a bipartisan bill that I introduced with Representative Donna Shalala, aimed at reducing the number of kids using tobacco products in the United States. And I did want to mention, Congresswoman Shalala, when you, Madam Chair, when you said happily, I was thinking about that because it's true. She's always happy, and she's always substantive at the same time. It's a rare combination, and it's also rare that somebody's the secretary of a major agency and comes back to Congress. But I think it's that, I was thinking about what Chairwoman Eshoo said, and I think that you're just very optimistic, and you always think that we can do things. And it's a day, oftentimes she'll come to the floor and say, I have a new idea, and be all excited about it, which is such a great thing. So I just wanted to mention that. Let me say that 55 years ago, the Surgeon General warned of the dangerous health effects of smoking cigarettes, yet 5 decades later, smoking remains the leading cause of preventable death. The use of tobacco and nicotine has evolved since that first Surgeon General's report. A quick Google search will lead you to an array of products online, including cigarettes, cigars, smoking pipes, and the most recent addition, e-cigarettes. And these e-cigarettes are now available in many flavors, and studies show that flavor choices like mint, candy, fruit, or chocolate draw the interest of teens in middle school and high school. Unfortunately, while combustible cigarette use among teens has declined over the past 2 decades, there is a widespread and false perception that e-cigarettes are safe. And I have to say, I've been to some of my middle schools, and that's what I would get until recently from the students, that, oh, they're safe, there's not a problem here. And this false belief threatens the progress we've made in combating this public health threat. Compounding this alarming reality is the fact that nearly all tobacco use begins during youth and young adulthood, which is a crucial period for the development of the human brain. Recent data shows that over 3.6 million youth used e-cigarettes in 2018, making this product the most commonly used tobacco product on the market. Last month, our Oversight and Investigations Subcommittee held a hearing on the public health threats of e-cigarettes, and I remain deeply concerned about the outbreak of lung illnesses associated with e-cigarette use and vaping products. The most recent report from the CDC confirmed 26 deaths in 21 states, and at our oversight hearing, CDC stated that they expect the number of cases to increase by the hundreds. So I firmly believe that the youth vaping epidemic we face today could have been addressed if the FDA had moved forward with reviewing all e-cigarettes on the market when the agency first had the chance 2 years ago. And while I appreciate the administration's announcement to ban flavored vaping products, we have yet to see that promise come to fruition. 10 years ago, Congress took significant bipartisan action when we passed the Family Smoking Prevention and Tobacco Control Act, which gave the FDA regulatory authority to regulate tobacco products, and that was a strong step. But now, given the shocking increases in the number of teens and young people using e-cigarettes, our bill takes this authority a step forward. It extends FDA regulation on the sale and distribution of tobacco products, including e-cigarettes. The bill raises the minimum age for purchasing tobacco to 21 and makes it unlawful for any retailer to sell a tobacco product to any person younger than 21. And the bill also prohibits non-face-to-face sales of all tobacco products and bans all flavors of tobacco products, including mint and menthol. Now, this bipartisan bill has widespread support from groups like the African American Tobacco Control Leadership Council, American Academy of Pediatrics, American Cancer Society, American College of Cardiology, American Heart Association, the Lung Association, Thoracic Society, Campaign for Tobacco-Free Kids, March of Dimes, and the National African American Tobacco Prevention Network. These groups say loud and clear, we're facing a serious problem that needs a comprehensive solution. And as the committee responsible for protecting the nation's public health, we have to act. It's my intention to advance this legislation this fall, and I hope we can do so with strong bipartisan support, because we simply can't lose another generation to a lifetime of nicotine addiction. And I want to thank the witnesses for being here today and look forward to our committee's discussion on this important bill, Madam Chair. Thank you, and I yield back.